joined here by Dr. Patrick Whelan, MD, PhD, so twice as hard, who is a pediatric specialist at UCLA, a hospitalist, immunologist, rheumatologist, and rare disease expert, and probably a bunch of other titles I don't have here. But welcome, Dr. Whelan. I thank you for putting on the show, and I'm really interested in learning about this new syndrome. I think it's PANDAS, right? PANDAS?
That's right, yes. Thank you for having me. And I'm not physically in San Diego, but I'm delighted to be back in San Diego virtually. So let me tell you real quick about what is this PANDAS syndrome. Well, in 1998, a group at the National Institute of Mental Health published a paper about a series of children that they had seen referred from around the country. And they developed a series of criteria that fit to this condition. The first was that the kids had to have the presence of obsessive compulsive features and or tic problems. They had to be young kids. It was typically a sudden onset of these kinds of symptoms, and that there were new episodes that seemed to be linked to infections. And in their case, they described a connection between strep throat, strep infections, and these neuropsychiatric symptoms. They added one other layer of criteria on top of that, which was that these kids had a lot of associated behavioral abnormalities, things like depression, underlying anxiety issues. Sometimes psychiatric thought disorders like schizophreniform features, schizophrenia. So these conditions include much more than this, as I found in my own practice. One of the big things is rage reactions in kids. And emotional lability is a very common feature where they'll be perfectly fine one moment, and the next moment, I've had a couple of kids who start biting their hands aggressively, or they'll start hitting their mother, or they just start screaming at the top of their lungs. And you can imagine how poorly received that is when you're in a daycare setting or in a preschool, when one child starts biting the other children. So as they get older, they develop more of what are called oppositional behaviors, or ODD, oppositional defiant disorder. And they can become, some of these kids, they get really big as teenagers. You can imagine how menacing someone becomes when they get angry over some little thing that happens. And all of a sudden, they're like a raging monster. Psychomotor agitation, the last thing on my list, is just, these are fidgety kids. They're constantly in motion. They can't sit still in a chair. So in a sense, you can pick them out the moment that they come in the office. Not all kids with psychomotor agitation have PANDAS, but pretty much the other way around. So let me just share with you from that first paper, they looked at the age distribution. And you can see on the bottom of the screen where the age of the child is, that there's this peak at around age 6, and then it trails off into the tween and teenage years. So the model for all this basically is that you have a susceptible host. In my experience, it's 3 things that we see in these kids. They typically don't sleep well. That's number 1. Number 2, they have what are called sensory processing problems. They're very sensitive to certain things in the environment. Like sometimes they're kids who wear the same clothes all the time, or they're very sensitive to being touched in any way. These children do not like to be touched. I have a patient right now who hasn't worn any clothes for the last 5 months. He's just too sensitive to the feeling of clothing on his body.
That's so wild. I mean, I have a million questions, but just to interrupt one, I mean, a lot of these symptoms sort of overlap with what people think of as autism, or the schizoid affective, arc. Boy, it must be, I mean, it seems like with Osler, we might find out 30 years from now that many of these psychosomatic diseases or psychiatric disorders have this root, that could be solved so easily. What do you think?
Yeah. Well, one of the things that we're studying in that vein, from a research standpoint, is trying to find out if there's an abnormality in the immune system that we could put our finger on. And David Vetter, the boy whose picture I showed at the beginning, had a genetic condition called severe combined immune deficiency. or SCID. And now it's been demonstrated that in most cases it's a single nucleotide mutation that's on the X chromosome, so it affects boys disproportionately. And last year they've developed for the very first time a stem cell therapy that can cure David's disease. So of course we're very interested to find out in a more complex condition like this one, are there specific genetic abnormalities that could be identified, or specific misfiring of the immune system that could be modified in some way that would help to address this. Yeah.
But it's not like you could pick amoxicillin for anxiety. That's a completely dumb idea, right? Or is it?
Well, that is a very interesting question, because the first treatment that we have, the first approach to many of these kids is to treat them with amoxicillin. And part of the reason is that strep, even we hear so much about antibiotic resistance, pretty much all beta hemolytic strep are still sensitive to amoxicillin. And in the kids who have pure PANDAS syndrome, oftentimes treating them with the course of amoxicillin, their symptoms just melt away. And you think, wow, this is exciting, very satisfying that something as simple as that. But as you can imagine, these kids are along a whole spectrum of severity, and some of them have no response to antibiotics at all. So we've tried to develop several new layers of therapy that can treat kids that have more disease that's refractory to antibiotics. So I started to tell you that, this is sort of the disease model. You have susceptible host with this sensory hypersensitivity, anxiety problems, sleep problems. They get exposed to a pathogen like beta hemolytic strep, and then their immune response, that normal natural thing trying to get rid of the bacterium, results in this abnormality in their behavior and in their movement. And that is essentially what PANDAS syndrome is. So I made an allusion a moment ago in response to your question that the immune system is pretty complicated. This is a list of all of the different categories of immunodeficiency that the World Health Organization recognizes. And it's a measure of just how complex the evolution of our immune system has been over 1 million years to protect us against all the different things that are going on around us in the environment. And one of them, this is the last thing I'll just mention to you in terms of organized remarks. There's a condition that was hardly recognized at all 50 years ago called DeGeorge syndrome, which in recent years has been recognized to be mutations, either duplications or deletions in a particular chromosome, the 22nd chromosome. It's the smallest of all of our chromosomes, and on the long arm of the 22nd chromosome, the deletion of certain developmental genes results in the loss of the thymus gland, which is where our T lymphocytes are developed. They also develop problems with calcium metabolism. And so the typical classical thing was DeGeorge patients would present in the delivery room. As soon as they came out of their mom, they would start having a seizure in the delivery suite because they had low levels of calcium. They were hypocalcemic. And it's because they didn't have their own parathyroid glands that regulate calcium. But it turns out now that kids that have this disorder, called the 22q11 deletion syndrome, have not only neonatal seizures in the worst cases, but they're also much more likely to have developmental delay. They also have autism spectrum problems, and much more common things like ADHD, anxiety, depression, and schizophrenia. And it turns out that there's just a fascinating connection in these patients between their immune system and their behavioral disorders. So for instance, patients with schizophrenia are much more likely to have 22q11 deletions than people in the general population. So from a research standpoint, as far as we're concerned, this fascinating nexus between our immune system, our behavior, and susceptibility to infection, that's essentially what we're studying in these patients and trying to bring some normalcy into their lives. So,
that's incredibly important to like the general population here. First, because it shows you how amazingly complicated evolution has been, and our bodies are, our genetics, and how really brilliant people like yourself have to approach it from so many different ways. It's not an easy issue to grapple, but it's just completely fascinating, it seems to me. So that's
Yeah.
another interruption. Please continue, doctor.
Well, so what I've tried to describe to you is that there's this interesting set of disorders that are coupled to beta hemolytic strep. Classically, it was rheumatic fever, but now we're appreciating that there's this whole other group of kids who have what's called the PANDAS disorder, or another term that is more widely being used now is called PANS, or the pediatric acute onset neuropsychiatric syndrome, where you can't find any evidence of strep. So this raises a really fascinating issue that there are a lot of people that will tell you in the medical world, I don't believe in PANDAS.
Right.
They think that all of these patients are psychiatric patients. They belong in the psychiatric clinic getting their OCD disorder treated, or they should be seeing a neurologist having their movement problems addressed that way. So you can imagine a lot of families are coming to us and saying, I don't want my child on psychiatric medications. I don't want them to be on guanfacine or, movement disorders treatment. Tell me what's causing this disorder. And that's sort of the focus that we're taking as rheumatologists are kind of the consultants of last resort. So we tend to see a lot of kids who have seen many other doctors and nobody's quite sure what's going on with them. And one of the goals in rheumatology is to take diffuse or diverse symptoms and bring them together with some unifying explanation. And I've been very lucky to have a lot of great colleagues. I have a great son who's pictured here, but my great colleagues at UCLA are Jim McCracken and John Piacentini, who run the OCD, Anxiety and Tic Disorder Clinic at UCLA. And I'm involved with a group at Stanford run by Jenny Frankovich and some doctors in Tucson who have launched a clinical trial nationally with intravenous immunoglobulin to try and see if by modulating the immune system, we have the capacity to, make a big difference for these kids.